One confirmed. Perfect. Thank you so much. Great. Again, welcome to day 3 of the Washington Group meeting. As always, we start the day with a few housekeeping items, and at this point, I can tell that you all already know the routine because you're already introducing yourself into the chat, and thank you so much for doing that. We've had no microphone issues to my knowledge, so thank you so much for that. Today we're going to have quite a bit of opportunity for discussion, especially during the last session where we talk about priorities and interests and next steps. So speak slowly if you can for the interpreters. They always appreciate that. And as usual, please make use of the chat box. We will be putting into the chat the slides. There are 3 slide decks, one for each day of this meeting, and we've already finalized today's slides, so those will also be added to the chat. So please do scroll up and down to find those files so that you can save those to your files. We already mentioned that the meeting is being recorded, and of course we are sharing out materials as quickly as possible. If there's anything that you want to reach out to the Washington Group Secretariat for, please do that. We're happy to get back to you and send you what you need as soon as possible. So with that, I will turn this over to Natalie's capable hands to start session 7, where we're going to have brief report outs from yesterday's breakout rooms. Natalie?
Hello, everyone. All right, so welcome back. We're excited to get started with day 3 of our meeting. And the first session of the day, as Julie said, is that report out from the regional breakout rooms that we had yesterday. So as a reminder, yesterday we closed the day by giving everyone time to join regional breakout rooms where they could speak with other members of their region about activities in the region. These breakout sessions were designed to facilitate discussion and collaboration among members of those regional groups, as well as other colleagues in the area. So the first item of business is, the first item of business yesterday in those groups was to assign a rapporteur who would report back to the full Washington Group membership on their discussions. And so that's where we are now. At this point, it's time for us to hear from those rapporteurs. I do want to mention that this session is scheduled for 45 minutes, which means that each rapporteur will have about 5 to 7 minutes to report out. So please keep that in mind. We're looking for short reports. So I would like to start with the Brazzaville group. Steve, are you here today? Would you be able to provide a short update on what's happening in the region? All right, just giving him another minute to see if Steve's here, but if not, I can move on and maybe he'll pop in later. Perhaps Julie, you can let me know if you see Steve join.
I'm looking, I don't, and this
Okay.
this typically happens. People can be
The
delayed
time
or,
differences,
right,
yeah,
exactly.
yeah.
So we'll move on.
All right, no problem. Let's move to the Buenos Aires group, which seemed like they were having a vibrant discussion yesterday. Is the rapporteur from the Buenos Aires group here today?
Hi, Natalie. Can you hear me?
Yes, we can hear you, Nicolas. How are you doing?
Right. Fine, thank you. Well, I'll start. I will change to Spanish because I have my notes in Spanish. So please, I understand that the interpreters can make this happen to translate it in English. So please let me know if something is needed to be clarified or whatever. So I will.
Nicolas, sorry, one thing I just want to let everyone know, since Nicolas is going to present in Spanish, you may need to change your
Yeah.
the interpretation. Currently, you may be in the room that's the original language that's being spoken. So if you look for the little globe icon in the bottom right corner of your screen, there's an interpretation room for English. So I encourage you all to switch there if you want to listen to these remarks in English. Thank you.
Thank you, Natalie, for that. So I will change to Spanish. Well, continúo en español. Ahora sí. Dos o una cosa importante para decir, yo soy Nicolás Petreschi del INDEC de la Argentina. Hemos sido coordinadores del Grupo de Buenos Aires desde sus inicios. Y en ese sentido tengo una noticia alegre y triste a la vez, que es que nosotros dejaremos, en este caso, la coordinación, el rol de coordinador. Eso a nosotros luego de bastante trabajo y de bastantes años siguiendo esta temática, tanto con el Washington Group como con los países de nuestra región y la CEPAL. Eso en algún punto nos entristece, pero también entendemos que es tiempo de que nuevos miembros de la región tomen la posta y puedan seguir. Y en ese sentido también estamos muy contentos de anunciar que el INEGI de México pronto tomará las riendas, pronto será nombrado como el responsable de la coordinación de este grupo regional, con lo cual en las próximas semanas seguramente estarán recibiendo un correo en el que les contemos estas novedades por escrito. Ahora bien, rápidamente, intentaré ser breve. El día de ayer nosotros nos juntamos con países como, bueno, además de la Argentina, Brasil, Colombia, Costa Rica, México, Panamá, Paraguay, Perú, República Dominicana, y nos acompañó también la CEPAL. En ese sentido, además de abordar las preguntas que se propusieron desde la Secretaría del Washington Group, consultar sobre la entrega de los Annual Country Survey Form y la necesidad de asistencias técnicas que podían surgir, se charló sobre un taller que se había propuesto por el Programa Iberoamericano de Discapacidad para evaluar un curso, un posible curso sobre estadísticas y discapacidad. Todos los países que participaron hicieron sus devoluciones y sus aportes. Y luego los países pudieron contar un poco acerca de los proyectos, un breve repaso sobre los proyectos, sobre las estadísticas de discapacidad que realizaron, que están realizando o que planifican realizar en un futuro cercano. En ese sentido, paso a contarles dos o tres cosas de lo que dijeron cada uno de los países para que tengan un pantallazo general o una visión general sobre lo que está ocurriendo en nuestra región. El INEC de Costa Rica, además de enviar el informe país, comentó que la última encuesta nacional sobre discapacidad se realizó en el 2023, en 2023, y que recientemente se presentaron los resultados. La última encuesta contó con la muestra más grande realizada hasta el momento, y con respecto al censo de 2022 aún no se han publicado los datos. Se planea hacer un sistema integrado de encuestas de hogares para el 2027, para el 2027, en la que se está trabajando en este momento. Por el lado del IBGE de Brasil, ellos han enviado también el informe país, aunque tienen algunas dudas específicas sobre un test de las proporciones, considerando el ajuste por edad. Han enviado consultas a la Secretaría de Washington Group sobre la fórmula, ya que el IBGE percibe que cuando encuentran algunas dificultades para identificar pequeñas diferencias entre las prevalencias dentro de una muestra de población muy grande. Por otro lado, vale destacar que el IBGE posee un grupo de trabajo sobre discapacidad. Aquí seguramente están conectados sus representantes. Y contarles que el próximo año se realizarán dos encuestas nuevas que tendrán un módulo sobre discapacidad, la encuesta nacional de salud 2025 y la encuesta de presupuesto familiar también 2025. El IBGE posee algunas observaciones puntuales acerca de esta encuesta nacional de salud, para la cual enviará seguramente sus dudas en las próximas semanas o en los próximos días. Por último, informaron que el año próximo se divulgarán los datos del censo realizado, el censo 2022, con datos de discapacidad y autismo. Por el lado del INEGI, como ya les había informado, nos han comentado su disponibilidad para asumir el rol de coordinación del grupo, con lo cual, de nuevo, en las próximas semanas recibirán un correo con esta información. y expresó que además el informe anual ya fue entregado y se está desarrollando el informe país, sobre el cual hay algunas dudas de estandarización por edad para hombres y mujeres y para el último grupo de edad para empleo. También comentaron que se incluyen, perdón, preguntas del set corto del Washington Group en 14 encuestas. Se informó asimismo que respondieron al Banco Interamericano y al Programa Iberoamericano de Discapacidad los comentarios sobre el curso que les comentaba antes sobre discapacidad, este posible curso que se está armando. Y en este momento se está realizando una prueba piloto de la encuesta intercensal que se levantará el año que viene. Por último, se encuentra en curso la encuesta nacional de gasto e ingresos de los hogares, que incluye el set corto del Washington Group. Desde el INEC de Panamá, por su lado, se comentó que se está realizando la segunda encuesta nacional de discapacidad, en la que se utiliza también el set corto del Washington Group. Asimismo, se expresó que en encuestas permanentes se utiliza el set corto. En cuanto a futuras actividades, se firmó un convenio para realizar las MICs, las encuestas nacionales de niños, niñas y adolescentes, el año que viene, en la que se utilizará también el set corto del Washington Group y se aplicará de forma exhaustiva la temática de discapacidad. Por último, ahora sí, Daniel González, representante de la CEPAL, comentó que se están realizando se está realizando desde la CEPAL un análisis de las preguntas y la calidad de los datos en los censos realizados en la región de la Ronda 2020 y que tendrán el documento como borrador para noviembre de 2024 que incluye también un análisis sobre las estadísticas de discapacidad. Simplemente mencionar que la Argentina también envió su informe, su Annual Country Survey Form y que también realizó comentarios para enriquecer el trabajo que está realizando el Programa Iberoamericano de Discapacidad. Si alguien del grupo siente que no expresé del todo alguno de los temas, por favor, coméntemelo o escríbanlo en el chat. Y eso sería todo de nuestra parte. I will change back to English. I hope that everyone can understand what I said in Spanish and in English. So we are open to any inquiries that you may have. Also, I will leave the email of our group in the chat box if anyone wants to send us any question, comments, or whatever they want. So thank you, Natalie, and thank you, everyone.
Wonderful. Thank you so much, Nicolas. Really great to hear what's going on in the region. And you know, we're sad for you to be stepping back, but we hope that you will remain actively involved. And we look forward to future collaborations. Thanks so much. Okay, all right. So moving to the next group, is the rapporteur from the Casablanca group here today? Anyone from Casablanca here? If not, I'll check in later with that group. All right, what about the Kathmandu group? Do we have the rapporteur from the Kathmandu group here today?
Yeah, may I come in? I'm Ms. Asha Gaur, representative from NSO India. I'll be the rapporteur for Kathmandu group.
Wonderful. Okay. So we're looking forward to hearing from you. One thing I do want to just note is if folks could remember to be mindful about pace when speaking, if you could speak slowly, that really helps the interpreters a lot. But yeah, please take it away. We're excited to hear about what's going on in your region. Thank you.
Yes, thank you so much. So basically, while we had a discussion in the Kathmandu group, all the representatives from the all the members from the Kathmandu group presented their progress that they have made so far in collection and compilation of disability statistics. So they also enlightened us with this. Thereafter, a discussion was held among the member countries regarding the future course of action. There were major 3 future course of actions that came into light. Number one was the finalization of terms of reference of the group.
Oh, I think we may have lost connection. Is there anyone else from that group who wanted to pop in? Otherwise, I'll give them
Hello.
a minute. Oh, hi.
Hello.
Hi, are you
Am I
able to
audible
hear
now?
us? Yes, we can hear you.
Yes. I'm extremely sorry. There were some connection issues.
That's all right. Please
Yes.
continue. Thank you so much.
Okay. Yes. So there were, as I was saying, that there were three major course of actions that were designed for our Kathmandu group. The first one was the finalization of the terms of reference of the group. So the group has already started the work of preparation of terms of reference, and a draft has already been worked upon. So it will be finalization would be one key major point that has to be decided by the group. Secondly, we decided to chalk out a roadmap wherein it was decided that a virtual meeting will be held in every quarter and a physical meeting annually. Thirdly, it was decided that we should make endeavors to hold a physical meeting so that detailed discussion on the disability statistics and its inter alia connection between various other components and segments can be discussed. In this regard, NSO India will be taking the lead. So these are the major takeaways and highlights of the Kathmandu group. Thank you.
Wonderful. Thank you so much. All right, that's exciting to hear about all of the discussions that that occurred yesterday. I did pop into that group at one point yesterday, and it was really interesting to hear what is going on. And of course, in any way the Washington Group Secretariat is able to help, we're always happy to be a resource for technical assistance and all of that. All right.
That would be really appreciated. We'll be looking forward to support from the Washington Group Secretariat. Thank you.
Wonderful. Thank you. Okay. So I'm just going to check to see if we have someone from the Casablanca group here now who would be able to report on those discussions. So that would be countries in the Arabic-speaking countries in the Middle East. Is anyone from that group available to report? All right. If not, let's check with the Southern. Oh, sorry. Go ahead.
Yeah, we had CO2 report because Neo is held up somewhere, but I don't know whether she's in.
Yes, I am in, Renis.
Yeah, thank you.
Am I audible?
Yes, you are.
Am I?
Great. So,
oh, okay. From the South and Eastern Africa group, which is chaired by Kenya and South Africa, yesterday we had 7 people representing 5 countries who attended the session. It was Kenya, South Africa, Botswana, Mauritius, and Somalia. And in terms of what have been done since the last meeting, the group consistently held the bi-weekly meetings to discuss the regional group activities. The group held a regional group meeting in Kenya on the 27th to the 29th of February this year. And in that meeting, the advocacy for the compilation of the country reports was made. And the next meeting is scheduled to take place in Malawi on the 5th to the 7th of November. The preparations for that meeting are underway, and invitations have been sent to countries who responded and indicated that they will attend. The group is hoping to have at least 3 country reports for this regional group. And with regard to progress on the country reports, the progress is in terms of the countries that were part of yesterday's session. The Kenya report is ready and have been shared with the Secretariat for the comments. And with regard to South Africa, the report is at an advanced stage. However, there have been challenges with availability of other key indicators, the income and the unemployment. And with regard to Somalia, the disability tables are ready and they require the technical assistance regarding the age adjustment. Regarding Mauritius, they just completed the census report and they still have to commence with the country report. Regarding Botswana, they have started with the report and they will be able to share the progress in the meeting in Malawi. All the countries, they have indicated that continuously when there is a need for the technical support, they will liaise with the Secretariat, including then Monty for the assistance. And with regard to the challenges, the group have the problem of the active participation of the countries in the meeting. And this is one of the issues that the group is battling with and trying to come up with mechanisms to encourage the countries to be active in the meetings. That is it from our group. Thank you.
Wonderful. Thank you so much. It's great to hear what's coming out of the region, and yes, Southern and Eastern Africa. We applaud you for what you've been doing to hold these in-person meetings in the region and provide support as a way to provide support to the preparation of country reports on disability. I did want to comment on one thing that I just heard mention of here, and that I've also heard mention of in some of the other discussions, which is I know that some countries want to create these country reports on disability, but the data they have do not have all of those indicators like educational attainment, family income, and employment. And we do actually ask that if you don't have those indicators available in your data source, and you can't find another data source that is nationally representative, high quality, and all of that, go ahead and do the report and leave out those indicators. That's something in our frequently asked questions document that we address. So it's better to still have those estimates of prevalence by age, by type, by sex, even if you cannot present all of the indicators disaggregated by disability status. Great. Okay, so moving on. Let's see if someone from that Europe breakout room is available to report out today. Is the rapporteur from the European room here today? Anyone from Europe available? All right, what about the Casablanca group? Do we have anyone joining at this point? I know the time difference is tricky. Anyone from Casablanca?
Hello,
Hello, how are you?
I'm fine. About you?
Great, doing well, thank you. Are you available to report out for your group?
Yes, this is Riyadh from Saudi Arabia, and I'm reporting for Palestine and Morocco.
Fabulous, thank you. Please go right ahead.
Okay, what we are going to say first, we are going to talk about just about Morocco. Okay, regarding the country report and disability in Morocco, it created based on the data collected from the population and housing census that was carried out in Morocco in September 2024. And we don't need any assistance for the report because the website of Group Washington contains all the elements we need for completing this report. The second point concerning the activities since last WG 23rd, we included the WG enhanced question on the upper body function only in the National Household Survey on a Living Standard, which is the living condition survey that was conducted in starting from 2022 to 2023. And also we included the WGSS in the 2024 population and housing census. For the future activities, we will create a country report in disability based on the data of the 2024 population and housing census, and it will continue to include the question of Group Washington and disability in the next household surveys. This is regarding Morocco. Regarding Palestine, okay, currently Palestine is not considering preparing a report since the last census was in 2017, and they already created analytical reports regarding that. However, it's possible that standard report will be prepared after conducting the census in 2027. Regarding the technical assistant, I believe that Washington Group has provided all the tools necessary to help countries prepare such reports. Since the last meeting, Palestine has continued to integrate disability-related questions from Washington Group short set of questions into household surveys, such as labor force survey and the household expenditure and consumption survey. Palestine future plans focuses on the assessing of the impact of after Israeli aggression and evaluating the need across the sector with a particular emphasis on disability issues. Among these future plans is the intention to conduct a specialized survey of individuals with the disability. And MEX 7 also will be organized on 2025. Those are for Palestine and Morocco. For us, Saudi Arabia, as my colleague said, that we are already started the report based on the data that we received from the census 2022, and it was all published on the website since 2023. Also, we conducted a survey that is directed to people with disability using the WG, the enhanced questions and other indicators. And this was also published on April 2024. Regarding our future plan, of course, Saudi Arabia is going to have the demographic indicators survey that is going to be in the 2025, which is going to include the short survey of the WG, and it will have also the wide survey for people with disability on the 2026, inshallah. This is it for Saudi Arabia. Maybe the mix is going to be also in the 2026. That will include the UNICEF questionnaire for children with disability. That's it for our group.
Wonderful. Thank you so much. Sounds like there's a lot of exciting activity in the region. I was glad to see there was a lot of participation in the breakout room for the Casablanca group yesterday. Great. All right. Do we have anyone who attended the breakout room for the European countries here now? Would anyone like to report on that group?
Yes. Hello. This is
Hello.
Katri Sääksjärvi from Finland. Yes,
Wonderful.
we had a small group present, if I recall right, at least from Latvia, Portugal, Poland, Hungary, Bahama, and Finland. And most of us reported that the work is either already ongoing or beginning of the process or waiting for data, so that the work is planned to start soon. And at least for all EU countries, most of them will work with the EU Silk 2020 data. And Bahamas reported that they have also conducted their survey and already started the analysis, and the timetable is to finish the report by the first quarter of year 2025. So Eurostat included the wiki short set questions, 6 items in the EU Silk data collection for the first time in year 2020. Some questions were before that too, but not the whole set, I believe. Regarding the question on assistance, we discussed that assistance is needed, documents and guidelines at least, but also there will be needs to solve the issues individually, perhaps per email, as there are different problems with different countries and data sets, and at least guidance on age adjustment is needed. And the final question on whether your country is going to use the 6 VG questions in the future, at least the European Health Interview Survey EHIS 2025 will include the short set or a mixture of the questions from the other sets too. And from now on, EHIS will be conducted every 6 years, and the results are presented at Eurostat database. And that's the report from yesterday.
Great. Okay. That's really good to hear. And I heard in that report out that some of the countries who were interested in creating those reports, the country disability reports, would like some guidance documents and technical assistance. So, you know, we have tons of guidance documents available. If folks from the various countries in the region have not received those guidance documents, we encourage them to email the Washington Group Secretariat, and I can drop that email address into the chat in a moment.
I just did that.
Thank you
I
so
put-
much, Julie.
I put both
Perfect.
Dan's email address and the Secretariat's email address in the chat just now.
Perfect. Great minds. Right. So please reach out. We will be very happy to send you those guidance documents. And we're also very happy to provide technical assistance, including on age adjustment. I know we've done that with some of the countries in your region already. I know we talked to Latvia, for example, about some of the questions they had about preparing a report. So yes, keep doing what you're doing. Reach out to us. We're here to help.
Natalie,
Okay.
if I
Oh,
could just
sorry.
maybe add
Yeah.
a little bit to that, because I think the
Please.
age adjustment issue has come up a couple times in the reports. And you are, as Natalie said, absolutely welcome to directly contact either the Secretariat or Dan for that kind of technical assistance. Or if you prefer, we could do another kind of one of those question and answer webinars that we did a month or so, or however, I don't remember exactly when, but we did a couple of them where we just was a kind of open forum and countries could come and ask questions and hear answers from other countries. If you would prefer that, just send us a note, tell us you would like to do that. And if, you know, we get 2 or 3 positive responses to that, we're happy to organize that webinar. They only last about an hour. We try to do them at a time that's convenient for everyone. But please do get to us. Questions about age adjustment should not be stopping anyone from doing a report. we think we can respond to all of them.
Yes, absolutely. And some of the new guidance documents we have actually provide SAS and STATA syntax for creating those estimates, those age-adjusted estimates. But yes, as Jennifer said, we could also do another question and answer webinar for multiple countries to attend. So please let us know. You can send us an email if you would like to have one of those, if you would be interested in attending a webinar like that again, or you can pop it in the chat. Okay, great. So I think that covers the groups. I did just want to give a quick little update on the Brazzaville group, since we didn't get to hear from them this morning due to time difference issues. We just wanted to note that group is organizing an in-person meeting. They will be holding a 3-day meeting next week in Djibouti. And the focus of that meeting is really going to be basically a workshop for producing country disability reports. And we're looking forward to seeing the outcome of that to All right, so thank you everyone for reporting out. Before I transition to Jennifer, I just wanted to check if there's anyone else who wanted to share an update from the region that was not covered in those report outs. All right. So in that case, I'm going to turn things over to Jennifer Maddens, who will introduce the next session of the day. We're a little ahead of schedule, but I think that gives us more time for a very vibrant discussion session after our next session. Thanks so much.
Thanks so much, Natalie, and thanks for all of you who attended the breakout groups and provided feedback. I would ask if any of the rapporteurs, if you have written notes that you were using to make your presentation, even if they're not in English, if you could provide those to us, it makes it a little bit easier. That and the recording make it easier for us to kind of write up the brief summaries of what was going on. Sometimes the recordings kind of go in and out. So if you have anything in writing, we would really appreciate hearing from you. It's not, it would be really useful to keep track of all of the past, ongoing, and planned data collections that are using some of these tools. So we can share that information as we get requests for what's going on out there. So thanks very much for that. As we've said, often Washington Group Secretariat acts somewhat as a clearinghouse for questions and connections. And one of the topics that we get questions about is now that people are starting to use the tools and putting them into different surveys, they are sometimes getting different prevalence estimates. And this, of course, is very confusing, primarily to policymakers who are not as well versed in the intricacies of data collection as we are. And so for some reason, expect every number to be exactly like every other number, which of course never happens. But for some reason, any kind of variability in a disability prevalence causes a lot of concern among users. And the request was made if we could address this a little bit more straight on. This is one of those topics where we would love to hear back from you if you would like to the Secretariat to do something to work further on this in the coming year. We could set up a small work group, we could do a webinar. There are a lot of things that we could do to do a little bit more work in this area and be a little bit more proactive. So I encourage you at the end, when we start thinking about our work plan for next year, if this is something that you are confronting, that you would like assistance in, that you think that it would be useful to have something from the group dealing with this, please let us know and we can try to figure out how to do that. But for today, Dan Mont, our great colleague from the Center for Inclusive Policy and longtime Washington Group member, has agreed to kind of set the stage about why disability prevalences might vary, looking at some of the various reasons for that, and giving us a good basis for what we might want to do to move forward. So I'm going to turn this over to Dan.
Thanks, Jennifer. Nice to be with everybody, even if it's only virtual. I miss our big meetings when we all get together. So as Jennifer said, this is actually an issue that goes way back to the very first meeting of the Washington Group, where people were like, how come these estimates of prevalence are all over the place? Do we know what we're doing? Why do they vary so much? And it's very disconcerting to policymakers, to not just the policymakers, but to organizations of people with disabilities who don't like certain estimates. So what I thought I'd do today is kind of go through almost like a troubleshooting exercise of why the disability rates vary so much. I have to say, when we get to the end, I'm not going to have a definitive, complete answer for everybody, but I think hopefully I'll be able to sketch out the various reasons and things that can maybe help us focus on understanding this even better. So next slide. So the first reason is that different data tools might have different approaches to identifying people with disabilities, right? Some tools, be they administrative tools or surveys or censuses, might ask about medical conditions and impairments. They might just ask about self-identification. Do you have a disability? Some surveys ask about program eligibility. And do you have a disability certificate? Are you receiving disability benefits? In some tools, they ask about statutory categories, right? For example, in India, there's a list of particular disabilities that qualify you for a disability certificate. And so in the data tool, they ask, do you have these things? And it makes sense that they want to collect this because they're trying to collect data on the people who they think are going to be qualifying for the program, right? But it's a different way of doing it. Then there's functional limitations. So the Washington Group approach, that's what the Washington questions do, right? They ask about difficulty functioning in different domains. And then there's some surveys that use a combination of methods. For example, the Thai National Disability Survey asks the Washington Group questions, but it also asks about impairments. And when they calculate the disability rate, they add together those who are identified by either of those methods as having a disability. So the first thing to look at, if I'm comparing disability prevalence rates between two countries, two tools within a country, is to see, are they approaching identifying people with disabilities the same way? Because if they're not, they're going to get different prevalence rates. Next slide. So what if we're just talking about functional limitations, right? So we're going to put away the medical conditions, the self-identification, those approaches that are really not in line with the Washington Group. Okay, but let's say we still see differences in prevalence between two countries or two tools within a country, even though they're both taking a functional approach. Well, first, they might have a different number of functional domains or a different number of questions within a functional domain. For example, as this group hopefully knows well, you'll get a different rate whether you're using the extended set, which asks about more domains and more questions within a domain, versus the Washington Group short set. You'll have a higher prevalence rate with the extended set than the short set. Maybe it's a functional question, but it's a yes-no response instead of a scaled response. The American Community Survey in the US asks yes-no questions. They will get a different rate than if they ask scaled responses. Another way, there could be a different threshold. So maybe you have a scaled response. People have no difficulty, some difficulty, a lot of difficulty, cannot do. Maybe one report is drawing the line at a lot of difficulty, which is the sort of Washington Group standard for doing it. But maybe a country says, you know what, we see people who have some difficulty in multiple areas. They seem to be experiencing a lot of exclusion too. So we're going to look at them as well and consider them to have a disability. They're using a different threshold, therefore they're going to get a different amount. Or another reason why it could be different is because you could be comparing one instrument to an instrument designed for children. Okay, so if I look at the disability rate for children, say between the ages of 5 and 17, and I'm looking at especially 5 to 10, I'm looking at a census, I'm going to get a certain rate. But if I use the MICS, the Multiple Indicator Cluster Survey, which a lot of your countries have, and that includes the child functioning module, clearly the child functioning module is going to identify more children than the census, right? So so that's another reason. And then it could be that even though you're taking the functional approach, you have a problematic question design. So some countries will put multiple functional domains in a single question. Now, do you have difficulty seeing, hearing, walking, communicating, et cetera, et cetera? You put all those things in together, you're going to get a different number, probably lower. Sometimes countries will have a complicating clause like, do you have difficulty walking that you expect to last 6 months or longer? Or there's some other clause in there that makes the question more complicated. We think that undermines the quality of the data. So these are all reasons, even if you're taking a functional approach, why you might have a difference. But the next slide. But now let's say, okay, forget all that. We're all going to use the Washington Group short set. So we put a lot of these reasons why you might have differences between two tools. We're going to shove those to the side for a while. And we say, okay, I have 2 countries or 2 surveys within a country, and they're both using the Washington Group short set. Why might they still have a difference? Well, I divide it into 2 categories. The first is maybe they're not implementing those questions correctly. Maybe they have an introductory statement like, now we're going to ask you some questions about disability. We know that that's going to affect how people answer the questions. I've seen some surveys that actually have a screener, like, do you have a disability? And then if people say yes, then they ask in the Washington Group short set. Well, clearly that's not really using the Washington Group short set. It's using the question, do you have a disability? And the Washington Group short set is being asked to try to divide between the types of difficulties those self-identifying people have. So that's clearly not doing it the way that's recommended. There could be a numerator error in how the questions are delivered, right? Somebody might go into a numerator goes into the house. They are embarrassed to ask these questions. They see someone who they think has no functional difficulties, and they think it would be insulting. And why am I going to ask you if you have difficulty walking? I just saw you come over here and sit down. So it's, you could have enumerators who, for various reasons, maybe they're being paid by how many surveys they're doing in a day, so they're trying to get through as fast as they can. Maybe there's some sort of stigma or embarrassment that's affecting the way they're asked the questions, right? Those things could affect the rate. Another thing could be poor translation, right? We've talked a lot in the Washington Group about proper translation protocol, and we have many stories of how questions sometimes have not been translated correctly. And so poor translation could affect the responses. But maybe the questions are being implemented exactly as asked. They don't have those introductory statements. There's no screener. The enumerators are well trained. You've translated things. There could still be reasons why you get a difference in prevalence rate. One is it could be proxy versus self-response, right? So if you're asking, say, the head of the household about everybody in the household, you're going to get a different answer if you had actually asked each individual person about themselves. And there's some data about this, about whether you'll get higher rates with self-response than you do with a proxy respondent. Another reason could be placement within the survey, right? If we always want the Washington Group questions to be asked way at the beginning in the household roster, so they can't be affected by other questions. But if you put those questions right after you've asked people about health conditions, like, do you have this chronic health condition? Do you have this chronic health condition? Now I'm going to ask you, do you have difficulty walking? The mindset that that person has in answering the question is going to be different. And it's going to affect their answer. So we might say this is not implemented correctly. I guess you could have put, maybe I could have put it in the other column. But I'm saying that even though the questions are are being done correctly. Their placement in the survey could affect it. Another reason could be the sampling frame. For example, in many household surveys, the institutionalized population and the homeless population are not included in the sampling frame. And we have reason to believe that those people are disproportionately disabled. So if I have a census which tries to get everybody in the country, and I'm comparing it to a survey which is excluding the institutionalized and homeless populations, or maybe certain migratory populations, that's going to create a difference in prevalence. And then, like I was referring to before, actually, a different difficulty threshold is used. So you're using the Washington questions, I'm using the Washington Group questions, but I consider anybody who has some difficulty in anything to have a disability. In the United States, I think I'd get like a 40% rate. If I only include the people who cannot do one of those things, it goes down to something like a 2% rate, I think. So depending on the threshold, I'm going to get a different prevalence. So these are, again, a whole set of reasons why you might have different prevalences. Next slide. So why else might prevalences differ? Well, they might differ for reasons having to do with the fact that the actual underlying prevalence is different, right, between two countries. A big one, we think, is the age distribution, because whatever country you look at, the probability of having a disability is associated with age, and not linearly. I mean, in most places, once you start passing age 50 or so, the disability prevalence rate really starts going up. So if I'm looking at one country that has an older population versus a country which has a very young population, all other things equal, the disability prevalence rate is probably going to be significantly higher in the country with the aging population. Okay. Also, there could be differences in survival rates of people with disabilities. Okay, I might be in a car accident. I have something happens to me. I have disability for some period of time, and then I die because I don't have access to good health care. Whereas a person in another country has the same disability, but they live longer because they have access to good health care. Also, I could say something like maybe the person in the car accident dies right away and the other person becomes disabled. So differences in healthcare, differences in survival rates from different things could also drive differences in prevalences. And that's a real difference, right? That's a real difference in the prevalence rate. And of course, incidence of disability because of a whole variety of factors, the healthcare, nutrition, living conditions, whether I'm in a conflict country, right? So there's real reasons why that are not have to do with measurement, but have to do with real underlying differences in why two countries or two regions of a country even might have different prevalence rates. Next slide. However, taking all these things into account, we still seem to have a few countries where the Washington Group short set seems to be implemented according to the protocol, and we have really low rates of disability. Kenya is one example where it looks like the Washington Group short set was implemented, exactly according to the protocols that we expect, and yet they have a really low disability prevalence rate. Similarly, the child functioning module in Thailand, this isn't the short set, but is also yielding much lower rates of disability for children than found globally, right? Globally, if you look at the UNICEF report, they say it's like 10% of children. But if you look at the Thai National Disability Survey, which again is implemented totally according to protocol, they even cognitively tested the translations, much lower rate. And so we don't have, like I said at the very beginning, we don't have all the answers as to what is going on, why in some countries the rate seems to be coming in is so low, or even as low as the question is, do you have a disability? Which is really confusing because in most places that's not the case. So we really want to uncover the reasons. We want to really investigate this more because it's becoming an issue, especially when people are, convinced to use the Washington questions, they invest in doing it, they field it, and the data comes back and they're surprised at what's going on. We really want to be able to understand that better. So next slide. Oh, okay. Yeah, next slide. I kind of said that already. I'm not sure why these slides are kind of talk about this. Keep going. Okay, so what we want to do is how can we better understand the differences? So we want to we want to enlist your help for some of you to work with us to better understand why we get different results using the same questions in different surveys in the same country. How the prevalence rate changes within a country depending on the type of data collection platform, and also how other prevalence rates change. There's a lot of focus on disability. Actually, disability questions and disability prevalence rates seem to get much more focus than a lot of other things. So what do other prevalence rates look like? How does the poverty rate differ from one platform to another? Okay, what does the marriage rate look like? What other prevalence rates are out there? And is the disability prevalence rate, does it vary more than the other indicators that also change from place to place? So what we want to know from you is, have you done previous analysis on these issues that you can share? Would you be willing to share data for such analysis so that we so we can look into it? And would you be interested in developing a webinar on this topic? Basically, we want to explore why one country might differ from another, why two tools within a country might differ from each other. And we want to investigate this further. So basically, explore all the reasons I mentioned up earlier. And once we can either rule those in and we have an explanation, or we rule them out and we realize something else must be going on, we can try to uncover, what the story is and whether these differences in disability are of a different scale than differences in other indicators. Employment rate is going to be different in the census versus the household survey. Is the difference as big as the disability rate is between the two? Or are we basically seeing the same kind of variance that happens because of, all the things that go into implementing a survey? So we really want to find those of you who are willing to work with us on this so that we can maybe start answering some of these questions. Next slide. Thank you. And I'm really curious if any of you have any other thoughts of reasons why those prevalence rates might vary so much that I haven't thought of. Either that you have evidence for, which would be great, or you don't have evidence for, but you think is something that is worth investigating, that should be part of our investigation to look into this particular question.
Thanks, Dan. Claire put something in the chat. I'll just read it, that we have also found that the context of the survey has made a difference. For example, we tend to get a lower rate in our household labor force survey than our well-being or health-related surveys, even when using the same questions. And I think that's pretty universal. We have the same kind of evidence in the US that when we have used the same questions in, for example, our current population survey, which has a lot of labor force stuff in it, and our health surveys, we get very different estimates. And I think that's exactly what Dan was kind of asking us to summarize across many countries. If we can identify these drivers of different rates, both across countries and within countries, then maybe we can provide a context for everyone to discuss these issues with their policy and program people. So it's kind of a two-pronged approach here we'd like to take. Why in one country are we getting rates that we think may be too low, even though they follow the protocol, and another not? And then Are there differences in survey context that within a country would make a difference? And again, this is not new to disability. This is, can we show examples of other things so our policymakers don't get so upset if they should see a different number out of the labor force survey and the health survey? They should expect it. So I have a couple of things in the chat, and I also have a hand up. Roxana, would you like to I think you can unmute, but I'm not sure. Yep, looks like you can. Go ahead.
Hola, ¿qué tal? Buenos días. No tengo evidencia, o sea, no tenemos evidencia en el país de lo que voy a decir, pero por la experiencia en determinados levantamientos de datos, me da la sensación que hay un aspecto que es muy difícil de controlar fuera de lo que sería una especie de investigación dentro del laboratorio, que es el aspecto cultural de la discapacidad en cada uno de los países e incluso en cada una de las regiones dentro de un mismo país e incluso dentro de los distintos universos a los que focalizan las distintas encuestas. Por ejemplo, incluir el set corto de preguntas del Grupo Washington en una encuesta de salud o en una encuesta demográfica probablemente también arroje distintas prevalencias porque el universo sobre el que vamos a buscar la información es distinto. A esto es a lo que quiero llegar. Yo creo que a lo mejor la contribución, vuelvo a repetir, no es desde un sustento numérico, es decir, desde algo probado, pero sí tratar de ver cómo se puede incluir este factor cultural en los distintos test cognitivos que se hacen en los países. ¿Por qué me refiero que hay algo cultural? Porque volviendo al origen, como decía Daniel Montt, el origen de la temática discapacidad viene con mucho peso de prejuicios sociales. Y los prejuicios sociales, a pesar de que vamos avanzando en que la discapacidad sea visible y que cada vez sea más inclusiva dentro de las sociedades, en las personas probablemente sigan quedando pesos prejuiciosos con respecto a la discapacidad. Por eso es que podemos preguntar con el set corto, podemos controlar que los encuestadores lo hagan de manera correcta, podemos controlar que la ubicación de las preguntas estén correctamente dentro de un cuestionario, sin embargo, no podemos controlar qué es lo que las personas piensan o sienten a la hora de responder. Esa era mi opinión. Gracias.
Thank you, Roxana. Go ahead, Dan. You can talk anytime.
Oh, okay. I think the cultural aspect of things is really important. In Thailand, when they got the really low rate of childhood disability, their hypothesis was a cultural one. They said, oh, gee, when parents are asked these questions about children's difficulty, they felt that the parents would be answering it as if, is this a difficulty for me, right? And no one wanted to admit that their child causes them difficulties. That was their hypothesis. So we did the cognitive interviewing afterwards to see if that's how parents were interpreting the question. In this case, it turned out that wasn't the case, but it could have been, right? But that was an instance where there was a hypothesis that there was a cultural reason behind it. And we did some cognitive interviewing to kind of investigate whether that was the reason. And it turned out in that instance, it wasn't the reason. But I think those kinds of cultural hypotheses and doing the cognitive interviewing in places where people have them is probably worth exploring. It's the only way I can think of. I mean, I don't know if anybody else has another way of thinking about how to see whether that's affecting how people answer the question. I mean, we kind of feel that there's less of that because we're not using the word disability, right? That was one of the reasons we move away from the word disability. But just because there's less of it doesn't mean it's not there. So,
just to add a little to that, what we can see when a survey goes into the field is what's written down as the protocol. But even the people running the survey, they don't really know what's happening on the ground. They can't observe every interview. And the amount of training interviewers get or enumerators get to follow the protocol varies by the kind of survey. So I recall early on in Washington group discussions where we said, you know, the census is probably the worst place to get disability data because it's such a huge endeavor. And there's so many layers of training. You know, they have the master trainers and the train, you know, kind of when you get down to the enumerator, yeah, they have all this material and they've been trained, but do they really follow the rules? And we've heard anecdotally, and so it's just anecdotal, that actually the enumerators are still using the word disability and are still worried about asking the questions. And so they don't ask them. I don't know if that's really true, but for me, it's interesting where we have multiple sources in a country. Is the census always the lowest, and how much lower? And what does it look like in a survey where perhaps a health survey where you have better context, people are more willing, there might be less stigma associated with reporting, better training of interviewers and so forth. Is that the pattern we see where things are low in the census because we think of the way censuses are conducted, and then maybe a little bit higher in a labor force survey, but then highest in a health survey? That makes sense to me. I'm not saying I could prove it, but if it happened in every country, it would be some way of explaining this kind of variability and perhaps some low rates in censuses, because how it's actually administered probably varies a lot from country to country. Dan, I'm going to read out some of the chats and feel free to respond. Just might be easier that way. Daphne said also the order of where the items appear in the survey, what context preceded has an impact. And I think that's, yeah, absolutely true.
And that's what I was saying before about whether it was in the household roster versus whether it followed the health questions. So I think that's been shown a lot, that the order of the questions affects people's answers, not just to disability questions, to all questions, but to disability questions. Yeah.
Maybe that's another variable we could look at across countries, you know, in terms of variability, not across and within countries. Where was it in the different surveys that you're talking about? Maybe we can quantify that. Rajan also reported a 2.2% rate in Nepal. Renice brings up there's another issue with computation. Some countries are likely to use cases as the numerator instead of individuals with disability, which that certainly would give you different answers. Let's see, an interesting comment here. Ooh.
Can someone interpret a little bit more using cases in the numerator?
Yeah, I didn't really get that.
And I'm not sure that everyone might understand that comment.
Renice, do you want to come in and explain?
Yeah, maybe if I can explain a little bit why we got a lower prevalence compared to the previous census. For example, we realized that when it comes to computation, and you consider the domains, for example, most of the programmers, if they don't really understand how the overall prevalence is computed, even if they have the syntax, they're likely to mess up because to them, they feel that they treat it as if the domains are mutually exclusive, while we have cases where people have got multiple disabilities. So when you sum the number per domain, you know whatever you get is cases. While if you treat an individual once as per the syntax, where you only count Renice once for the overall prevalence, then obviously the numerator will be less than what you get when you consider cases.
Yep.
So we experienced that when we were analyzing. That's what happened in the other one where we used screening questions. So even comparing becomes totally different, even though the functional bit and the screening bit also differed. So maybe I was just saying my thought that some countries are likely to miss out that bit because, you know, not all programmers are familiar with disability aspect. Thank you.
Thank you, Renise. Yeah, those, as you say, we try to keep the computation as consistent as possible, but sometimes it's lost in translation between what we want and what the programmers do. Rajan raises an interesting comment as well about some users are happy to see census-produced prevalence rates, which are generally quite low, and some others don't believe the prevalence rate by the census. And I recall again in our early years when we showed that you get higher rates using the short set than had been in the past, people were not happy about that, and countries were not happy because they again were equating the disability rate with providing maybe social protection and being used as a eligibility criteria for providing financial assistance, which they felt would break the bank. So they were not happy. And again, our messaging about it's a continuum, you have different definitions for different things, you have different cutoffs for different things, there's not one population, does not seem to have taken a strong hold in the user community as it perhaps has in the producer community. And I think that is, again, something that we might need to spend a little bit more time on, that might come out of this activity, that we focus so much on the data collection and how to do it. We haven't maybe done as good a job in explaining to users how to use the data. I think
Suzanne has her hand up.
Yeah, go ahead, Suzanne, while I try to work my way through some of these other comments.
Thanks. I think this is a great initiative and very needed. And as you're saying, I think we've spent a lot of time on the fidelity of the questions themselves and understanding how the data is being collected in the field and how that matters. And one of the related areas, I think, is who's answering the questions and how that differs across the different surveys and instruments. And some of the instruments, attempt to get a random adult in the household to respond. And I think we need to understand if that's actually happening, or because from other research on collecting subjective data, sensitive data, we found out that it was actually polling firms that did a very good job of that randomization process because that's so essential to their work. And often, the enumerators are supposed to go back to the house 3-4 times, set a date to go back. And that just, that's just not the reality, and that doesn't happen. So they end up interviewing, and you can see at the end of the day, your sample is disproportionately retired people, unemployed people,
right.
and that affects your disability rates as well.
Yeah, that's a great point. As we're talking, I hear people are raising potential factors what we could look at and see if there's variability. In fact, that's what I'm kind of thinking about this. Is there a way we could create some kind of database that looks at prevalence by kind of survey and how it was collected and who the respondent was? And hard to know whether the randomization was done well without getting actually in the nitty-gritty, but it's certainly something to bring up. Claire also, she's also says there's some suggestion that people are less willing to identify functional limitations in a survey related to work because of fear of work-related discrimination. And I think that's certainly been an issue, thinking about how to do this for some equal employment opportunity data collections. Like, if people think this is going to keep them out of the job market, they're not going to say anything, even if it actually would improve their chances of getting jobs. Dan, there are differences between countries in the level of assistance and accessibility towards this assistance between countries, subpopulations, etc. This factor may guide respondents to understand the questions and their motivations to participate in a survey in a truthful manner. So that's again one of these, it's a different context item than we've thought about before, but that's probably very true. Hopefully that would come cognitive testing, but maybe not. Go ahead, Dan.
If I remember back from the cognitive testing, I mean, I'm sure that what the point you brought up is true, but we thought that, and maybe, and this is worth investigating, we thought that had a lot more to do with the some category than the a lot of category in terms of people's standards for what constitutes a difficulty, what people's expectations of functioning were. That when we did the cognitive testing, we thought we found a lot more consistency in the cannot do and a lot of difficulty than we did in the some difficulty, which is one of the reasons why the threshold was drawn there, because it was felt to be much more internationally comparable to draw the threshold there. And then to look at the sums sort of country by country to see, hey, do people who are reporting those difficulties, are they also disproportionately experiencing exclusion? And if so, we need to think of them as you know, at risk as well. But yeah, but the whole context of where people live and the kind of supports that are available and what they see around them, yeah, can absolutely affect their, you know, could affect how they interpret the question, and especially the response categories. Yeah.
Myra notes that she notices there are changes when we consider the use or non-use of assistive devices in the question that, you know, certainly would make an effect. And I know while other than the seeing and hearing, the Washington group questions are without, there's always the question, are they really without, or are people answering them with, especially if see their assistive devices as more within the skin than we did. Robert says, I discovered a very interesting phenomena using the short set enhanced questions. The prevalence was extremely high due to high prevalence rates of anxiety and depression. And yes, that does increase it considerably.
Yeah, and especially with the child functioning module, that was really, when you include the psychosocial, it really drives up the rates. And the interesting thing was that the correlation between outcomes like educational attendance was different for the psychosocial than it was for the others. So which is why when they do the reports, they like to report them separately, because, you know, people with different types of functional limitations face different kinds of barriers, and, you know, we can't really treat all people with disabilities as a homogeneous group, obviously, whether it's type or degree. And so once we start including those in, and I think sometimes in our analysis we have to be able to look by functional domains, because they play out. They can play out differently, even from country to country. They can play out differently depending, again, on the environment and the supports available and all that kind of stuff.
I think I will do a pitch here for the cognitive testing of the psychosocial disability question, because we think those are probably better designed to capture what we're getting at, rather than the symptom questions or sign questions that we're currently using, which I think there is a lot more variability in how those are interpreted, and very sensitive to that cutoff that is selected. Because remember, in the child functioning module, there's only one question, and the rates are very, very high, as they're actually much lower with the enhanced set. Dr. Hussain, you said you'd like to speak. Please feel free. Anyone who would like to give their comment in person, so to speak, rather than have me read it, should just raise their hand and unmute yourself. So please go right ahead. You there?
السلام عليكم ورحمة الله وبركاته. أنا سعيد بمشاركتي مع حضراتكم، وبجد يعني مناقشة مثمرة وجيدة جدا جدا كلنا. أنا أود بس أن أشير إن إحنا فعلا في آخر تعداد على عام 2017 قمنا بيه في مصر. كنا أدرجنا أسئلة واشنطن جروب للمرة الثانية، لأن إحنا قمنا بإدراج أسئلة واشنطن جروب لصورة ست كويشنز في عام 2006. ولكن كان فعلا عندنا مشكلة كبيرة جدا جدا، وهي توصيل أو فهم الأسئلة بصورة جيدة ومباشرة للمدربين ذات نفسهم في الأول. وفعلا كان مفهوم من كلمة اللي احنا نبعد عن مصطلح الإعاقة ونحط ونضع بدل منها كلمة صعوبات، كان موضوع هام لينا، لأن احنا تعرضنا لده في التعداد السابق. كانت عندنا نسبة الإعاقة كانت بتيجي قليلة من أسلوب مثلا دخول أو إلقاء كلمة معاق على المبحوث أو على الأسرة المعاشية اللي بيوجد بها أشخاص ذوي إعاقة. وكان عندنا مشكلة برضه تانية كانت بتقابلنا فعلا في موضوع الانتشار، بالذات في ريف وصعيد مصر، إن كان الشخص اللي عنده إعاقة وخصوصا إذا كانت بنت في لسه صغيرة، فكان ده بيعمل وصمة اجتماعية. فكان دايما بيخبوا إن فعلا عندهم في حد معاق، وكان اعتقادهم إن الشخص المعاق هيخلف معاق، أو الشخص الأنثى المعاقة اللي قرايبها مش هيتجوزوا، أو لو اتجوزوا هيبقوا معرضين إن هم يخلفوا شخص ذوي إعاقة. ففعلا كانت عندنا صعوبة فعلا في فهم الأسئلة جدا للسادة المدربين، ومن ثم بعدها طبعا للمتدربين اللي هم هينزلوا على الأسر المعاشية اللي هم هيكونوا مخصصين بيها. وفعلا كان يعني حققنا بعد استخدام مجموعة أسئلة واشنطن جروب اللي هي القصيرة الست أسئلة، حققنا تعتبر نجاح بالنسبة للأرقام أو لمعدل الانتشار أو لنسبة الإعاقة في مصر من خلال آخر تعداد. يعني كانت نسبة معقولة جدا مقارنة بالسنوات السابقة للتعدادات اللي كنا قبل ما ندرج مجموعة أسئلة واشنطن جروب. ففعلا زي ما حضراتكم أشرتوا فعلا إن ساعات الانتشار بيكون خائن، موضوع انتشار المعاقين في بعض المناطق، خصوصا زي ما اشرت لحضراتكم خصوصا في ريف وصعيد مصر. والاسئله فعلا يعني كلمه مصطلح الاعاقه لما غيرناه لكلمه صعوبه فعلا اثمر عن استجابه كبيره جدا من المواطنين. ثانيا برضو البلد في الفتره الاخيره عامله جهود ضخمه جدا جدا، بتقدم امتيازات للمعاقين من خلال كارت بيقدم لهم دلوقتي اسمه كارت الخدمات المتكامله للمعاق. بيكون ليه طبعا مزايا كتير، اذا كان في السكن او في الانتقال او في انه يحصل على سياره او الى اخره. فالحمد لله رب العالمين النسبه برضه اتغيرت في مصر، او المفهوم الاعاقه اتغير كتير جدا في مصر. بل دلوقتي بقى اصبحوا الناس المعاقين بيقبلوا ان هم يسجلوا من خلال موقع وزارة التضامن الاجتماعي دلوقتي عشان يحصلوا على هذه المزايا. ففعلا انا يعني متشكر لحضراتكم ومتشكر المداخلة وشكرا لذوقكم، شكرا جزيلا.
You're very welcome. And I just thank you for reinforcing that don't use the word disability, which has been kind of a Washington Group mantra since the beginning, which is why we selected difficulty, but also the importance of training and the importance of getting that translation right, not only literally, but conceptually and culturally, which has been another cornerstone. I noticed I missed a chat. I might have missed more. I apologize if, Julie, if you've been monitoring these, help me out, and Natalie. Dan, do you think that the collection mode, CAPI, web, paper, can influence? This is from Christina.
I'm sorry, do I think that?
Whether the mode of data collection, whether it's CAPI,
Oh,
web,
yeah.
paper.
Yeah, I mean, it might. I mean, again, that's something that we could investigate. I mean, if it's it might affect whether the enumerators actually ask all the questions, right? I mean, you know, it's harder to skip it, I think, in the CAPI probably. But no, I mean, I think all these things need to be looked at.
Yeah, I think that would be a really interesting methodologic survey to see, especially whether you don't have the interviewer interfering. Is that a good thing or a bad thing? You
Right.
know, they can
Right.
help you, but on the other hand, they can hurt you.
It would have to be
I
double
would-
blind. The enumerator
Yes.
should not know that that's what the test is about. Otherwise, it's
Yeah, that's
how
right.
how they
Exactly.
do it. Yeah.
Exactly. And there is such a push in countries to use these, large panels and move to web-based administrations that are pushed to people's phones and tablets because it's so much less expensive. But we don't really understand, what the effects of that are. So on a small phone, is it easy to even select the answers? Is the formatting and, adding problems to even participation? It's not a well understood phenomenon just yet.
Yeah, and the other thing I would add about that, this push to moving toward internet instruments is that we also, what goes hand in hand with that sometimes is issues with the response rates for some of our national surveys. And so there's a push to go to internet to try to increase response rates, but that doesn't always end up being the case. And then you have more selection occurring than you would like. And, I was previously at the US Census Bureau, and when I was there, we did a lot of work looking into why disability rates on one of our major household surveys started to increase in 2014. That one did not move to the internet, but we were seeing, some changes in response rates. And we ended up putting a paper out that kind of tried to get a grasp on why were the disability rates suddenly jumping up despite no change in the questions being asked. And what we walked away with was, it really had to do with selection, right? The sample just looked quite different from how it had in previous years, even though, our response rates were still quite good compared to a lot of other surveys. It's just getting increasingly difficult these days to get really representative samples.
And those may vary, the nature of that representatives might vary a lot across these different survey contexts.
Yeah.
And something to look at. Great. So I have our first volunteer to continuing ongoing discussions on this topic from Claire from New Zealand. She's very keen to be involved. So at least there is one person who would like to be involved, to continue these discussions and be involved and try to sort this out a little bit better. Exactly how we do that remains to be seen. But there's certainly been a lot of interest in this topic. So thank you, Dan, so much for starting us out. There is another method here, I think. Oops. And we have another person who wants to be involved from EDP. So there will be a lot of opportunity to become more involved in this and to try to figure out next steps and what we might do. And Suzanne volunteers. We're taking names and we will make a list. And somebody wants to say something. Please, anybody who wants to speak should just speak. Is that you, Elena, who wants to say something? Go ahead.
I was also thinking that in Italy, for example, the, privacy confidential law limited a lot of data collection on sensible data. So disability is in some way sensible data. Therefore, for example, these are questions that if people want to answer, they answer. If they want to skip, they skip. So that is also another factor that may change the level of pet center in the same country or across countries. I don't know if I make myself clear. I was
Yeah,
looking
yeah.
for
We
the
could look at the non-response rate, whether the non-response rates are
right.
different,
Yeah.
if they're at all correlated with the rate of disability. Yeah.
Yeah, that would be interesting. Yeah. Margie is also interested.
Me too.
She wants to look at, I got you already. She would also like to look at other sectors and their measures, for example, poverty. And yeah, I really think this two-pronged approach to me is very important. We want to understand as much as we can what is affecting any variation in rates, but we also don't want to hold ourselves to a standard that we expect 100% within a country that every survey is going to give you the exact prevalence rate, because we will fail. And I think we'll fail because I don't think you get it on employment or poverty or anything else. It seems to just be more sensitive on disability. For some reason, I think all disability data seem to be more sensitive. And people just gotten used to the fact that there's variation in poverty and there's one rate that we report and the other surveys are just kind of providing additional information. So I think we also want to provide that context to policymakers and OPDs and others that some of this is to be expected. And we need to understand it better, and you need to understand it, but do not expect every survey to give you the same rate. And some of them might be quite different for all the reasons that we've come up with, which would be good to document. And Dan would also like to continue working on this. Good. Thank you also for everyone who's been dropping stuff in the chat that they didn't have a chance to give us yesterday. We really appreciate that. And Riaza would like to be involved from Maldives. I think we have the beginnings of a very good group, but we would like as many people involved as possible. And what I think step one, well, first we need someone to head the group. I know that's a bigger lift, but we need someone to at least be kind of an organizer. The secretariat is happy to help in terms of administrative things, but we'd like to have someone kind of take the intellectual lead and then figure out where we want to go. If I'm not mistaken, I think we're almost at time for a break. Is that right?
Yes, yes. If I may come in, I do want to reiterate that our last session today, we're going to have some discussions about next steps and topics. And I would encourage anyone to drop into the chat their interest in working on this particular topic, but also any thoughts about, well, what is the next step? Should we have a webinar that does a deeper investigation or dive into some of these issues? Or have we laid out the issues very well, and now we need to decide, what do we do about this? Do we write a document that puts in one place all of these considerations? So the idea here is I'm hoping in session 10 that we return to a very rich discussion about this and where to go, but also other things. And I'm so appreciative of this particular session, because we've heard from so many of you, and it really feeds our souls to hear from you all. But at this time, it is
Can I
5 after.
Dan just wanted to say something.
Just quickly say, I think it would be a great idea if the Washington group put out an announcement of a forming of a working group that's going to be sort of laying out the various issues they intend to investigate, and the formation of a working group that's looking into this issue. I think that would be welcome news to a lot of people, that work is planning to go on, and hopefully maybe also give us a little bit of a pressure amongst ourselves. Oh wow, we just told everybody we're doing this, now we better do it.
So you're going to help us draft a concept note.
I can help with the concept note announcement.
See
of
how that works?
Sure.
No, you're not supposed to say that now, Julie. You're supposed
I know. I just shot myself in the foot, but you're already
You
signing
did.
it. You put your name in the chat. Okay, we definitely need a break. It is about 5 after the hour. We would like to begin again at 1/4 after the hour. But I will do a bit of a countdown here on the screen and let you know when we are 5 minutes out and 2 minutes out. So please take a break. We will see you very shortly for our next session. Over. Okay, everyone. It is 1:15. I hope you had a good break. We should thank Elena De Palma for these breaks. She she expressed her strong desire to have breaks, and I have to say I am enjoying having a moment as well in these 3-hour meetings. So thanks, Elena. And with that, I'm going to turn this over to Riaza Fatima, who's going to moderate a session where we're going to hear more about some of the experiences, especially around disseminating data and working with other organizations in that area from both Kenya and Maldives. So with that, Riaza, I hand the floor to you.
Thank you, Julie. So, dear members, in this session, as Julie mentioned, we are going to hear from countries on their experience in disseminating data on disability and how disability data has been used across the countries as well. So, with that, let me move ahead with our first presentation from Kenya, where Ms. Renis will present on disability data collection, the dissemination, and how the inclusive data charter they are working on, as well as other data initiative. Renis is working in the Kenyan National Bureau of Statistics as an assistant manager in the governance, peace, and security statistics. So over to you, Renis.
Thank you very much, Lisa, for that introduction. I hope you can hear me well. I'm trying to put on my camera,
Yes,
but I'll
we can
continue.
hear you, but unfortunately we can't see you.
Yeah, I'm trying to put on my camera, but it's not coming. But meanwhile, I'll continue.
Yeah,
So
please go ahead.
I'll present on the situation in Kenya when it comes to disability statistics. And good enough, a lot has been said since day one. So next slide. So I'll give some introduction, situation analysis for different sources of data. I'll talk a little bit about the Inclusive Data Charter and other initiatives, challenges, opportunities, and conclusion. Next slide. So in Kenya, disability statistics is hosted in Social Statistics Division and specifically in Governance, Peace, and Security section. And we collect it through the 3 major sources of data for now. That is census, surveys, administrative source, and we've been doing this since 2007. And we've had history that is all the way from using screening questions up to now, where we are now champions of Washington Group sets of questions. And as a country, during the last Disability Summit, we took it up like to promote inclusion of persons with disabilities. And now specifically, we signed into the Inclusive Data Charter in 2021, which has promoted the inclusion of the disability modules in various surveys. So I'll talk much about the Inclusive Data Charter in a slide after this. Next. So for our censuses, we did our last census in 2019. And this was the first time that we used the short set of
Renis, we can't, or is it me, or can everyone else hear her?
No, we've lost
we've lost her.
Renis's audio apparently.
Hi,
Renis, sorry, if
she's
Sorry?
back. Yes,
there you
Renis,
go.
please
There you go.
continue.
Oh, sorry. You're not getting me?
Now we are.
Oh, thank you very much.
Thank you. So
Yeah.
you had just begun
did
on
I-
this slide, Renis.
On the census?
Yes,
Yes,
please.
you were talking about census.
Yeah, thank you. I was saying that now for the census, This is the first time that Kenya used the Washington Group sets of questions, and specifically short set. We did it in 2019. And we also had an additional question on albinism. But now the prevalence, as indicated by Dan and other presenters, was quite low. It was 2.2. And we've been anxious as a country to see what other countries, especially our neighbors, are getting from their recent censuses. So the age adjustment bit will be of help to us, because we've been getting resistance from our stakeholders. As we all know, the number of persons with disabilities comes with money, if I may say so, especially when it comes to social protection. So they are really crying. But as an institution, we adhered to the standards, the threshold, and we feel that that's what we could get. We managed to produce an analytical report on disability. So when you go to our website, you'll get that. The one on albinism, unfortunately, it has not been launched, but the draft is ready, waiting for validation. So we hope we'll validate. It's never too late. Then another area in census was school census, which we did this year. It was just concluded last month. And we had questions on special needs education. We really championed for this with the support of our stakeholders who are now part of the Inclusive Data Charter. And we hope that we'll get good indicators from this. Though for this, we did not use the Washington Group questions. Next. Yeah, and then now for surveys, since 2021, when we signed into the Inclusive Data Charter, we've tried to carry out various surveys, and for most of them, we were including the module or the short set into the survey tool. And we did the first one after the census was Rapid Assistive Technology Assessment Survey. This one was spearheaded by World Health Organization, and even they have the data set with them, but we really took part in this. And we used the short set. And next was 2022 Demographic and Health Survey, where we also used the short set. Unfortunately, for all these surveys, the outcomes are different, because we all know survey designs, as we had discussed in the previous presentation. Each survey has different target groups or respondents and sample size, among other factors. So like for DHS, we got 5.2 compared to the 2.2 from the census. Then we also did another one on support needs. I hope I'm not too fast for the interpreters. Support needs survey for persons with disability and their primary caregivers. This one we did with the Social Protection Department, and it was very interesting. We have its publication in our website. So here we used several sets of questions. That is the short set. So we also had the child functioning module. And with the support of the UNICEF, we managed to produce this report. It's also in our website. And we got interesting indicators, especially for the caregivers. Then Kenya Housing Survey, which was just done recently. We had the short set plus a module on accessibility. I'll show you the questions that we included on accessibility, because we felt that housing and accessibility are very, very important or correlated. And good enough, we have a few indicators generated from that. So we are still waiting for validation. Once it's ready, it will be put on our website. We are also planning to include the short set in the upcoming Kenya Integrated Household Budget Survey, which has been piloted, but the main data process is yet to be undertaken. And the other one is National Disability Survey. I know one of the challenges at the end of this presentation, I'll say that what we lack from disability statistics section is resources to carry out our standalone surveys. I don't know what other countries are experiencing, but from Kenya, that's a serious or a major problem. Then we also had the bit of humanitarian approach based on yesterday's presentation. Kenya UNICEF office approached us to support them or give technical support, which we did. Next. Next slide. Thank you very much. So specifically for the housing, we had some questions on, sorry for that. The previous slide, yeah. We had specific questions on accessibility. So we were asking whether the people are experiencing any disability-specific challenges, especially for households with persons with disabilities, safety for persons with mobility challenges, satisfaction with accessibility and accommodation of their housing. You know, especially for the rental houses where people stay, persons with disability have got serious problems. Yes, the flat building might be in place, but if they're not accessible, persons with disabilities are likely to miss accommodation. Then the lighting bit, we also had some questions whether the people are satisfied with the lighting for individuals with visual impairments. Presence of wide doorways and hallways, we know those with wheelchairs. Then grab bars in the bathrooms, entrance ramps or no step entries. Then we also had lever style door handles, elevators in multi-story buildings. Then there was this one which I know the proportion of households are likely to be low, but we had a question on whether the housing units were equipped with visual or auditory smoke alarms, and also switches and electrical outlets at ease of or reach of the individuals with limited mobility, the height, same to the kitchen accommodation or the worktops or the countertops where they work. So this one, we had a blog on this, so it's with the Washington group. We believe that once we get those indicators, it will inform even further action for the other group where we were dealing with environmental issues. So let's hope we'll have something good from this survey. Next. Yeah, apart from the surveys, we also collect a few information on an annual basis for our annual publications. The number of persons registered, that is those with disability cards, those registered with the National Council, and also some information on cash transfers. So far for now, for the annual publication, we only collect that. So we hope we'll have more information. But now, apart from the three sources, as a country, we are currently working on citizen-generated data. We have a strategy, and we've already started engaging stakeholders, including organizations for persons with disabilities, to start presenting the kind of data that they have for our validation or quality checks, and also to be engaging us in their work so that at the end of the day, we may accept their work. Next slide. Yeah, so for the Inclusive Data Charter, all the progress that we've made, especially for the surveys, is because of this aspect of signing into the Inclusive Data Charter. The State Department for Social Protection and Global Partnership for Sustainable Development have been of help to us because they've really supported us in engaging with or bringing stakeholders together to discuss matters disability. As I'd indicated, from the low prevalence, the resistance was too much for the NSO. But with this arrangement, we've managed to convince our stakeholders that yes, the prevalence was low, but the data that we have in our analytical reports is good enough for their use. And even the kind of surveys that we have, once we have a module there, then we can also get good indicators. And right now, quite a number of them are now champions of disability statistics because of that. So next. Yeah, so for those of us who are not aware, the Inclusive Data Charter is based on 5 principles. And the major one is all populations must be included, which is also in the SDG. Then all data should, wherever possible, be disaggregated. And for our case, specifically by disability status. So that one has been part of our core area where we are considering disaggregation by disability status. Then data should be drawn from all available sources. So as a country, we are now considering including citizen-generated data. And then transparency, at least right now, institutions have started trusting the NSO, that is one. And they are now opening up to give us the kind of data that they have. And even with this, we are planning to open or constitute a statistical unit within the social protection sector, at least to assist in data production or even advocacy. And we are building capacity of various stakeholders on how to analyze and disaggregate or use disability statistics. So I felt this is important, and if countries can at least use this, and if at all you are approached by the global partnership, it's a good initiative, don't fear. Next. Yeah, so other initiatives, we have a technical working committee on disability, where we do meet quarterly, though more often virtually. And as I indicated, the stakeholders are willing, but if resources are not there, at times the attendance is not good, but at least it's a good initiative. And after signing the Inclusive Data Charter Action Plan, we came up with the Interagency Committee on Disability. This one is spearheaded by the Social Protection Department. We also have quarterly meeting. And the bit of data, innovation and technology, sorry, I've repeated that, is one of the subcommittees. And we also have other areas like inclusive education and training and inclusive health, among other subcommittees. So it's also assisting us to advocate for a use of disability statistics among stakeholders. Next. Yeah, so the major challenge that we've experienced as a country, maybe other countries will tell us how they are going about it. We have no major or specific source of funds for disability statistics. Like I've indicated, we've been planning for a national disability survey for like more than 5 years right now. But no institution or development partner is coming out boldly to say, like, we are going to fund this. The government is pledging each and every time, but at the end of the day, we've never received the funds. So that's a major challenge. So maybe at the end of it, I'll call upon all of us. I know I saw it, I think, on day one's presentation. Like for the Disability Summit, we really need to identify or work on ways of identifying a development partner specifically for disability statistics, because I know even the secretariat, it's overburdened. We've been pressurizing them with some of these requests, which they cannot manage. Then there is also the low prevalence rate. I've talked about it. The resistance was real, but through these initiatives like Inclusive Data Charter, we've managed to tame them. So that was a real one. Then now from within, generally, we've come a long way with disability statistics. Unlike gender and age and other areas, people did not understand why we really need a module. For example, in a survey like DHS, they almost kicked us out. Some of us, like Michelle Loeb can attest to this during census. It also happened during the demographic and health survey, among others. But right now, as we speak, at least there's that buy-in and people have come to accept that the disability module is now mandatory. So it was a challenge, but at least we've now overcome that. And then lack of or no statistical unit within the State Department. So, we really need to, we always build their capacity, because without a statistician in their unit or in their department, they don't understand some of these key areas, including interpretation of our results. Next. Yeah, so opportunities as a country, much or more of what we've been doing is we've been using the short set. So it's high time we now want to incorporate or start using the enhanced set, because we now have the buy-in, even from within. And then we really need to do further analysis of these other surveys, because, once you are given a chance to put a module, when it comes to analysis, you are only given a one-page chance to write something about the disability. But I feel like we really need a fact sheet or something beyond the overall reports. Then the strategy on citizen-generated data, the fact that we have OPDs, that is an opportunity for us. And then for the statistical units across ministries and the rest, the National Statistical Unit System Unit is there to support us. So in conclusion, next. So it's high time disability statistics is given priority, just like gender and age. So that's what I'm challenging all of us. Then the entire fraternity of Washington Group, let's identify potential donors who can fund disability statistics. Then I encourage members not to give up from the experiences that we've been having, especially after censuses. It's not good. I encourage us to continue championing for inclusion of disability data. It's doable. And then let's find what statistics can do beyond dissemination, especially as statisticians. Let's try to interrogate whether policies are being implemented or whether our data is informing policies. So thank you very much. That's what I can say for now. Thank you.
Thank you. Thank you, Renis. And I hear you well, because this, what you have highlighted is what we also face. The challenge is same, I think, across all the countries in terms of lack of resources, without enough funding to carry out standalone disability surveys. So I also feel it's important that disability also gets the same limelight as gender, climate issues across the different countries. So let me check the chat whether we have any question for Renis. I don't think
I didn't see any, Riaza.
So let's move with the next presentation for this session. So we have a presentation from Maldives next, where Ms. Junaina will share details on the current study done in the country with regard to disability and how disability data from census has been used in this study. Ms. Junaina has 10 years of experience in the development sector and has spent majority of her career working in community engagement. Presently, she is engaged as a consultant for UNDP to undertake the situation analysis for the rights of persons with disability in Maldives, which is a project carried out by UNDP, where Ministry of Social and Family Development, as well as Maldives Bureau of Statistics, is taking part. So with that, I hand over to you. Junaina, are you there? Yes.
Yes, I am here. Thank you so much for the introduction, Riaza. Are you able to hear me well? I hope everyone can hear me. And please, if I speak too fast for the interpreters, especially, please let me know. I tend to do that. Yes,
we
as
can hear
Riaza
you
was,
well, but please do go slowly for the sake of interpreters. Thank you.
I will try my best. Thank you. Yes, as Riaza has mentioned, we are currently building upon the data that was gathered through the Washington Group show set to conduct the situation analysis of the rights of persons with disabilities, and this is the first of its kind in Maldives. So thank you for the opportunity to let me speak about this. Next slide, please. To begin with, I would like to share with you a little, very brief introduction of the disability sector in Maldives. So the Maldives ratified the UN CRPD in 2010 and subsequently followed with the passing of a legislation specifically on the protection of the rights of persons with disabilities. And this was a very extensive legislation which included provisions relating to various areas such as provision of a financial allowance for persons with disabilities, ensuring their legal rights, access to public infrastructure, health services, transportation, and promoting equal opportunities in education and employment, among others. And it has specific articles related to women and children with disabilities as well. So it is quite progressive in that sense, but 14 years since its enactment, we are still facing a lot of challenges in its implementation. So there is quite a lot of barriers in terms of translating the sort of commitments we've made internationally and in our legislation into practice. Next slide, please. So this situation analysis is basically to get a better understanding of what are those sort of critical barriers that are limiting the implementation of CRPD. So we are looking into the sort of existing policies, systems, and current practices that are limiting the implementation, but also identifying the functioning and the capacities of the state institutions to protect the rights of persons with disabilities. And then finally, to identify what are the most significant interventions or measures that need to be implemented to address these issues. Next slide, please. So the analysis is being undertaken as a partnership between the Ministry of Social and Family Development, the Maldives Bureau of Statistics, and UNDP Maldives. But the organizations of persons with disabilities, or OPDs, also are playing a huge role in implementing the situation analysis. So they are part of designing the methodology. They've provided inputs in not only the design, but they are also part of the data collection team as well. And they will be providing inputs to the final reporting that will be done as well. Next slide, please. So because this situation analysis is being done as part of a broader program in partnership with the UNPRPD, which is the United Nations Partnership for the Rights of Persons with Disabilities, we are following the guidelines set by UNPRPD for the situation analysis. So this analysis will then include details of the country's context in terms of the theory of change that they have set, which then includes identifying the barriers and the opportunities to implementing CRPD and SDGs, but also setting recommendations for UN and the other development partners to create a transformative change in terms of disability inclusion. Next slide, please. But this situation analysis will also establish a partnership framework between to work with OPDs and other civil society organizations to undertake the sort of recommendations that will come forward from this situation analysis. And finally, this can be used as a baseline data for policy planning and implementation. So stakeholders, both local and international development partners, can use the situation analysis as an advocacy tool. Next slide, please. So just to talk a little bit about the analytical framework, not to bore you with too much details about that, but Just to let you know that the analytical framework that UNPRPD has set is based on a human rights-based understanding of change processes. So this includes the empowerment and collective action of rights holders. In this case, that would be the persons with disabilities and their families. Also, a particular set of preconditions that are crucial to ensuring disability inclusion, along with state institutions having the sufficient capacity to actually undertake their responsibilities. So this is the sort of framework that we will be working with in terms of analyzing the data. Next slide, please. So when we talk about the specific preconditions, there are 5 preconditions that UNPRPD's analysis framework identify as being crucial, and these are the preconditions where the data that we will be collecting, or that the data that we are collecting will be analyzed using this framework, using this lens. So these preconditions include equality and non-discrimination, accessibility, inclusive service delivery, CRPD compliant budgeting and financial management, and accountability and governance. And the strengthening of data and disability data management goes under accountability and governance within these preconditions. Aside from these preconditions, we also have some cross-cutting issues that we're going to look at. Our next slide, please. So some of these cross-cutting issues include participation, just gauging how the persons with disabilities are able to participate, ensuring whether the most marginalized or the most underrepresented groups within the disability community is included, and of course, addressing gender inequality within disability community as well. Next slide, please. So when it comes to disability collection, disability-related data collection and management in the Maldives, there are 2 pieces of legislation that particularly mandates the collection of disability-related data. And the first one is the Disability Act that I mentioned to you earlier, which mandates the National Social Protection Agency, which is overseen by the Ministry of Social and Family Development, to establish a registry of persons with disabilities in the country. And this is primarily to facilitate services for them and to provide the financial elements and other sort of assistance that they need. The second legislation is the Decentralization Act of Maldives, which mandates the local councils to follow up, to always keep in touch with the persons with disabilities within their islands to understand the needs and concerns that they have and help to address them. So this also includes local councils collecting data at the very island level and ensuring that it's up to date. Next slide, please. Aside from the government agencies that I mentioned before, Maldives Bureau of Statistics also has a huge mandate on data management and collection. So the Maldives Bureau of Statistics, or MBS, is mandated to strengthening nationwide data related to disability, and this includes ensuring that disability-related questions are included in nationwide surveys and censuses, and of course, strengthening the production of disability-related statistics from administrative records. So for the first time in Maldives during the census that was undertaken recently in 2022, the Maldives adopted the Washington Group shows that on functioning to gain data on the prevalence of disability in the country. And since then, MBS has been working on using this data on different platforms, and this includes publishing a report on disability, as well as, of course, this situation analysis that we are doing now. Next slide, please. Just to give you a little bit of some of the data that we got from the census. So the census revealed that currently we have about 24,401 persons with disabilities living in the Maldives, which is about 7% of the total population. And among them, 55% are women, 45% are men. There are also quite a number of children with disabilities aged between 5 to 17 years. And there are a lot more people with disabilities living in other atolls outside of the capital, Male. But having said that, there is a huge population concentrated in the capital city, Male, as well. So 35% of the disability community do reside in Male. Next slide, please. The census also provided data on the prevalence of disability in the atolls, disaggregated by the different atolls. So this is one basis that we used in terms of conducting the situation analysis and identifying how data collection should proceed. Next slide, please. So the data that was gathered from the census 2022 is now being used as the baseline for the quantitative data in this first ever situation analysis that we are doing on the rise of persons with disabilities in the Maldives. So the methodology of the situation analysis basically works to sort of supplement this data to gathering qualitative data on addressing the key issues of the situation analysis. Next slide, please. So there are two primary data collection methods that we are using for this situation analysis. One is key informant interviews that we have already held with 58 stakeholders. And these stakeholders include OPDs, state agencies like ministries, local councils, judiciary, etc., and civil society organizations, service providers of different sort of therapies in UN agencies. The other data collection method that we are using is focus group discussions. Next slide, please. The focus group discussions are being held with persons with disabilities and the parents and caretakers, and their parents and caretakers. So we're using the data from the census 2022 to determine where the geographical, which geographical locations we should base our data collection on. So in this way, we have selected the highest prevalence atoll in the north and south of the country, which is Hadal and Gaf Alif atoll. And then, of course, Male had to be chosen, definitely, because so much of the prevalence rate, the highest prevalence, with 35%, Male has a huge prevalence rate just in that city alone. So Male was chosen as well. And then Dal atoll was chosen because it is the lowest prevalence atoll in the country, just to give a comparative analysis of how the experiences of persons with disabilities change based on the number of people living in that atoll. Next slide, please. And then, of course, from each of the atoll, specific islands were chosen because each atoll might have up to 10 or even more islands, so we cannot, it was better for data collection for us to be able to sort of select specific islands. So in that way, we selected 3 islands from each atoll. One island is the one with the highest number of persons with disabilities in the atoll. And then 2 islands where the prevalence rate is lower, around 20 to 50 persons with disabilities in the island. This is again to give a sort of comparison between the experiences of people living in the big sort of island with the highest number of disability community versus people living in islands where there isn't a huge disability community. But of course, we did not collect data from islands where there were fewer than 20 persons with disabilities, just to ensure confidentiality. Next slide, please. We have faced some challenges already. The situation analysis is not completed. We are actually still in the process of data collection, but we have already identified some very key challenges even at this stage. Number one is that the census data for specific geographic locations have already become outdated. So for instance, we had selected one atoll in the central because it had the highest prevalence rate of disability in the central atolls. But when we cross-checked with the database from the Ministry of Social and Family Development and the local councils, the registry that the local councils maintained, the number of persons with disabilities living in the atoll has reduced greatly, even though the census was actually conducted in 2022. So even within these 2 years, the numbers have changed a lot. And there are two potential reasons for this. One is because of the high level of internal migration from the atolls to the capital city, Male. And this is to gain better services, whether it's health or education, and of course, more opportunities for employment as well. But there is also another reason, and which is that it could be because of the differences in definition and criteria used by the different government agencies. So the Maldives Bureau of Statistics, when conducting the census, used the Washington groups, showed that. But there is the other government agencies, such as the ministry and the local councils, they have a different definition and criteria to determine disability. So this challenge could arise from that as well. The other challenge we have seen is the limitation in the census ability to capture persons with intellectual and psychosocial disabilities. And this is primarily due to the limitations in the questions that could be added. The short set was used this time. Perhaps the enhanced version or could sort of address this challenge as well. But also, we have also observed stigma associated with psychosocial disability. So that could have contributed greatly to this as well, because people are not comfortable revealing their status to others. Next slide, please. Finally, we have identified this already from the interviews that we did with stakeholders. There are significant gaps in terms of the collection and management of data related to disability. And there is a lack of a standard measure of disability data collection across the different sectors and across different government agencies. For example, the Ministry of Social and Family Development and the National Social Protection Agency that I mentioned earlier, they rely on self-registration to collect data. So that means that it does not represent the entirety of the disability community, because some people are not even aware that they can register as a person with a disability. And then, of course, there is a lack of data sharing mechanism between the government agencies. So each government agency has their own, they're working in silos and they have their own databases. So there is that challenge as well. Next slide, please. Having said that, there are some opportunities. So the National Strategy for the Development of Statistics has now been formulated, and there are some efforts being undertaken to identify the limitations sector-wise on how and how to sort of improve the overall data management within the government. And the Maldives Bureau of Statistics is now working with these different government agencies to develop sector-wise action plans and to prioritize the key activities for the upcoming 3 years. There are also other potential opportunities to refine data collection, and this means relying on some of the interventions that are being undertaken from other different government agencies, such as the IBAMA initiative. So the IBAMA initiative is basically a local island level committee comprising of the local council, the health sector, police and schools, to tackle different social issues within that island. And they're already responsible for collecting community level data. So this is one sort of channel that can be tapped into as well. And there is a need to harmonize that data collection there as well. Next slide, please. So in terms of the next steps for the situation analysis, we are currently undertaking the data collection, and hopefully we'll be able to finish it within this week, actually. And once we are done, we'll be able to analyze the data and compile the report. The report will then be validated by the different stakeholders that have been involved. And next slide, please. And once the data has been validated, there will be a prioritization exercise undertaken to identify which of the recommendations are the most significant ones that needs to be addressed most urgently. And then following that, the situation analysis will be disseminated at both policy and technical levels as an advocacy form of advocacy. And then UNDP will develop a proposal as part of the broader UNPRPD program that they're undertaking to work with different government agencies for the implementation of the recommendations. So yes, that's it from me. Thank you so much for listening to me, and please let me know if you have any questions.
Thank you, Junela, and thank you again. Thank you, Renis, for making these two presentations in our annual meeting. Let me see if there's any questions in the chat before I hand it over to Jennifer. So there's one question in the chat which is what is the prevalence of disability in Maldives census 2022, I believe. So let me answer that question. So in census, we got a disability prevalence rate of 6.9 in Maldives, which is actually lower than what we got in our household income and expenditure survey, which we did in 2019. So I hope that answers your question. And Jennifer?
Thank you so much. And I wanted to thank both of the speakers for fantastic presentations. I think you, Riaza, who suggested, you and Renis, that we do this at this session. So thank you very much for that. I think it's a great example of really how far we've come from where we started, and the extent of the data collection that's going on in your countries, the use of the data by multiple partners, which I think is extremely important and very validating, and the idea of how you're going to move forward and how you're going to work together, the use of the survey data and the administrative data, which always comes up, and all of the problems with that because of the different definitions and how do we harmonize it. So I think it would be great if maybe there could be a couple of blogs on the Washington Group website that summarize your two presentations, just to show what can be done and what is being done, and to give others encouragement for doing the same. So thank you very much. I did have a request actually for Renis, actually, and you as well, Riaza, that kind of pertaining to our last session, that as your data come in using these different data collection platforms, if you could share the prevalence rates you're getting with us and the platform, so we can kind of keep track of that. Particularly, I think it's particularly important in Kenya, where you do have the lower rate. How does that compare to other surveys? I think, Renis, you mentioned that you got a higher rate in one of the other surveys, but I can't remember which one it was. But if we could get that information, I think it would be really important. But yeah, if you think about writing a blog on your experiences and all the accomplishments you've made, I think it would be really helpful. And Renis, if I had the answer to how to get countries who go to the Disability Summit and make all kinds of commitments, even about data, to actually do it, we wouldn't need to have had 24 years worth of meetings. We would have resolved this a long time ago. I don't know the answer there. I don't know how we get people to kind of, as we say, put their money where their mouth is. But I think showing them success stories is one good example. And then your work with the OPD community, I think, is critical. Because, I know in my country, I can talk forever about the need for data and how we've made commitments and we have to do it, and nobody listens to me. But if an external advocacy group makes a lot of noise, they do a lot better. So I encourage you to continue working with the OPDs and using them to make your governments and my government do the right thing. Thank you. Thank you again to both of you.
Yeah, thank you, Jennifer. We do have two questions in the chat. One is asking for the questionnaire that has been used in this study. So June, is it possible to share the questionnaire with the Washington Group members that has been used, or is it something that is already available? Thank you.
Thanks, Riaza. It is not currently available, but I assume it will be once the report is published. So yes, maybe I can check with the UNDP team and get back to you.
Thank you. And then we have a question on if disability data are disseminated through an ad hoc data warehouse or website. I think this might something that Renice could also answer.
Yeah, thanks for that question. So as I'd indicated, the findings from the demographic and health survey, support needs survey are on our website. So maybe after this, we'll work on the blog and maybe share the prevalence with the Secretariat for it to appear in the Washington Group website. Yeah, so for a good number of them that we did, they are on our website.
Thank you, Renice. And as for the disability statistics results and whatever we have done, it's also available on Maldives Bureau of Statistics website when it comes to Maldives. And as Jennifer suggested, I think it would be something good to work from our side as well, to have a blog on the Washington Group website. With that, I would like to end this session as we are running out of time and hand it over to you. Jennifer, right? You're going to take over. So thank you.
Yes, thank you very much. And again, thank you for both of the presenters in the past sentence and our great moderator. And I do look forward to those blogs. Sorry to put you on the spot, but I couldn't resist. So we are now to the final session of the 24th annual meeting. I can't believe it's almost over. And as Dan said, I really do miss seeing everyone in person. It would be great to have an in-person meeting again, and maybe we can. So as has been our process since the first meeting so many years ago, we always like to end with briefly reviewing our accomplishments as a group, and as we've described them at this meeting, and then also look at some next steps for where do we want to go. And again, I reiterate that the Secretariat will support you as much as we possibly can, but the Washington Group has only been able to accomplish what it's been able to accomplish is because of the work of the members. And so we take our lead from you in terms of what you want to do, but we also rely on you to actually get the work done. So if I can have the next slide, please. So very briefly, I just want to go through the accomplishments we have talked about at this meeting. So we talked about some activities over the past year, the assistance that the Secretariat and members have provided, both technical and subject matter assistance via email and meetings and webinar and documents. We welcome all requests for assistance, and we try to respond to as many of them as we can. And I think we're pretty successful in being able to at least respond to all of those and provide what is necessary. We did a report to the United Nations Statistical Commission. I think it was its 55th. Recall, we report every 2 years to the Commission. And last year, like most years in the recent past, we have been an informational item and are included in a joint report on disability statistics along with the other UN agencies. When you're an informational item, that you don't get discussed on the floor, so there's no feedback from that, and we would be due to report back to them, not this year, but the next year. But we did contribute to other disability-related reports and initiatives from the UN and from other organizations. And we tried to advance the work group activities as much as we could, particularly around the country disability report. But in in all instances where the Secretariat was asked for assistance, and that included supporting all of the regional groups on disability statistics and holding the webinars, particularly around age adjustment, and also expanding on the website. I should mention, though, that we consider the regional groups kind of independent in terms of their operations. So we don't call you, we wait for you to ask us for assistance. So just if you do need assistance in any way, please contact us. 2 major disability tools were completed this year. The child functioning module, teacher version, and the inclusive education module, both in close collaboration with our longtime colleagues at UNICEF, and both were launched at COSP this year. The inclusive education module is, I think, 10 years in the making. It is very, very good to see these tools completed. There will be more information coming out primarily on the UNICEF website about implementation and all of the documentation that surrounds how you might use these tools. We still have one major tool under development, which we heard about, the psychosocial functioning module. I know this module is anxiously awaited by many of our partners because we have always admitted that the short set and even the extended set do not do the best job possible on psychosocial functioning for all the reasons that we know. This is a very difficult area, also a sensitive area, hard to ask questions. I think you'll agree with me, there was a huge amount of progress being made by Elena and Margie on this in terms of the testing, the development of the testing protocols, all the testing they've done. It was really great to see the results combined across all of the different tests. But we need to do more, and we look to you for help in doing that. Now, in terms of work plan, other work plan updates and next steps, we do have the translation work to be done. We talked about the list of information items that we would want to request from all those submitting translations. We'd like to get feedback on that list, whether we've left stuff off, whether we've been overly intrusive. But we also need to work out and need assistance in determining what the format should be, both to get information from those having the translations, and then incorporating that information and the translations into some kind of web base that people can access. We do need assistance for that, so please contact the Secretariat. And again, that we saw from the mental health and psychosocial, the synthesized results from the cognitive testing, identifying areas where we might be able to make further changes, improve on those questions, maybe even shorten the number of questions. And we can't do that unless we do a little bit more testing. And as I think was noted in some of our discussions today, countries differ in their cultural context, and that may very much be an issue for psychosocial functioning. So the more countries that we can have doing testing in more different regions with different cultural connotations, I think the better off we will be, and the resulting set of questions will be much stronger. So we really encourage you, if you are all able, to work on not only the cognitive testing, but field testing of these items. Next question, the next slide, please. So what are the next steps for the Secretariat? This is what we're committing to you. We will continue to prepare Washington Group content for the UN website when we are requested to do that. And we will produce a summary, an executive summary of the what has happened here today, these past 3 days. You already have the slides, so that's a big step. So this will not be a detailed summary, but it will give an idea of what was covered today, and we will share that. The Secretariat will happily facilitate further meetings with the translation work group to advance our decision-making on how we're going to curate and format and document these translation versions and get them out so that it's easily accessible to those who need them. So we would like to facilitate these meetings, but we'd like to have people to meet with. So please contact us to be involved in this. This is not a 10-year commitment like the development of the inclusive education module was, or of the psychosocial questions, but more a short-term, hopefully not too intensive commitment to make some of these decisions and move forward. We are happy to assist countries in producing their country disability reports. Many of you have already sent that to us. Those of you who have not, we still would like to get them. So we plan, happy to get any additional requests for technical assistance, and we will happily respond to those. To the extent that we can, we will support the mental health and psychosocial functioning work group and the regional disability groups as they request assistance, and it is in our power to provide it. Unfortunately, financial support has not been in our ability to provide, but anything else we're happy to do. We will provide further developments and updates to the Washington website. We try to keep that up to date as best we can. If there's anything on the website you'd like to see and you don't, things that are confusing, let us know. We started with the session on data in emergency and humanitarian situations. We'd like to further engage on that topic, but one question is, what should we be doing in that space? Is that something that the Washington group should be working in, and if so, how and to what extent? And just, the heads up, we will be preparing the membership letters that go to your director generals, the head of your NSOs, requesting a designation of a representative. If we don't get anything back, we assume whoever's been the representative is the representative, but it's good to get something back. So just, if you can intercede to make sure that they get it and they respond to it, that would be great. But we will be sending those out soon. Next slide, please. So that's what we're committing to as the Secretariat. So this is what we think we heard you committing to as our NSO members, to complete the annual survey on the use of the Washington Group tools, send it as soon as possible so we can include it in the executive summary. And if you need any kind of assistance in doing that, please let us know. We will do the send out the membership letters again. That's our job. Your job is to, if you are in a position where you can be involved in the response or highlighting it to your DG that it's going to come, could you respond? And if, unfortunately, the ones who we don't get the responses for are where we don't have a rep, and it's likely that there is no rep on today, but if you are from an NSO, you don't know who the rep is, maybe there's a way that you can help us get a rep identified when we send these letters out to your director generals. Please share any information about products and events that you have, including any reports, papers, country or regional products, conferences, seminars, meetings, upcoming standalone surveys, disability and functioning surveys, and administrative systems. Whatever you have, please send to us. We will post them on the website as appropriate. Even today, we've heard about a whole lot of things we didn't know about were going on in countries that we talk to a lot. And it would be great to have that information on the website. So when in doubt, send it. And we may not be able to use everything, but at least we'll have the opportunity to make things more publicly available, particularly anything that you've made publicly available, we would like to make publicly available. But people do come to the site and do kind of look through it and pick things up. Speaking of the website, please join the website notification system. You can subscribe. You can disseminate the link to your networks, and they will get announcements, but they will also see these publications that you're all working on when we post them. So they'll get a notification that we're posting something, and they'll be able to see all the great work that's going on in Kenya and Maldives and everywhere else. So please feel free to share the website and the notification system with your networks. We can only make translations available if we get translations from those who are translating them. So please send us any tool that you have translated, particularly for a recent national data collection. And we will put that in our main database. And then, of course, we're going to ask you to fill out the form about how to information about it. But really, we're trying to make that form with very little burden. And then, of course, the country disability reports. Please consider a report in 2024 and contact, and early 25, I will say, contact the Secretariat or Dan Mon regarding technical assistance. To include it, I think I saw something in the chat, to include it for the World Disability Summit in April, we really do need to get it soon so that we can, kind of look at it, go back and forth, try to make it as consistent as possible. And we are hoping to get some external help to help with formatting, and to the extent that we can also put them together in kind of regional groupings, we will do that, but we need some time. And we also need to let our friend Sarah know that we have a large number of these reports coming in, so they will give us time at the summit to present them. If we only have 6 reports, I'm not sure that they will give us time. I don't know. We have not talked to her about that. We wanted to wait at least until some of the regional groups met this month and next month, just to see how many we could get. We will push to have those included, as many as we can get, but it will be very difficult to include them, for example, if they're coming in February. We may be able to do it, we'll try, but the sooner we get them, the better. Now, if you can't get it in for the Disability Summit, that's fine. We'd still like them. We'd still like to post them on our website. And the more we can post, the more the outside community will understand the extent of work that is being done by you. When the World Bank talks about their data hub, they're going to talk about the World Bank data hub. They are not going to talk about all the countries who created the data that they put in their database. So we think that showing all these reports in one place at the summit and on the website really gives evidence of how much has been done by national statistical offices to fill the space for disability data, and will give credit to you who deserve the credit. So please try to do them. If you have any questions, let us know. If you, as I think Natalie mentioned, if you can't do all the indicators, fine, leave them out. If you can just do prevalence, just send us prevalence. Do as much as you can, and we're happy to provide the technical assistance, as is Dan. Next slide, please. Future activities. One of the big disadvantages of these virtual meetings is it's much harder for us to maintain contact with all of you. And to make sure you're informed and to advance the work plan. So what else can we do? We think webinars might be a good thing. What would you like to see? They're only useful if people attend them. So what kind of webinars would you like? How do we increase participation in the annual survey that we send out, where we collect all the great information that's going on, all of the data collection that is going on? We get good participation. We don't get everybody doing it. Is that because it's a barrier? How can we make that easier? And what topics or areas would you like to see the Washington Group consider, including the ones we've talked about today, but others as well? We've talked about humanitarian. We've talked about these analytic and kind of theoretical ideas about how do we make data, how do we explain differences in data? It sounds like that's a very popular topic, but are there others? Julie, I think I hand this over to you now for the polls. Am I right?
Yes. So Jennifer has just asked out a lot of questions to get your feedback, but the only way we can think of to get your immediate feedback is to conduct a few polls. And so I'm going to show you the questions that will be part of the very first poll. This is a poll about the Washington Group webinars. And there are 4 questions asking, did you attend one in the past year? What topics for future polls, for future webinars would you suggest? Would you be willing to help organize a webinar? And if you would be willing to help organize, we're asking you to provide your contact information. So that poll is open, and we'll leave it open for about 2 to 3 minutes so that we can get some information about the webinars. You may recall at last year's meeting, this idea of conducting more webinars as a way to stay in touch, to disseminate information, to address topics of particular interest was raised. So we followed through with that, and we had 2. But I think, there is space to have more, and certainly if some of our partners and members can help us with that, that would be wonderful. If we close this poll before you've had an opportunity to finish all of the questions, please feel free to use the chat. We do have a couple of more polls to release. I see responses coming in, so I'm not closing it yet. Remember that you can scroll up and down in that window to see questions 3 and 4 if you don't see them right away.
While people are doing the poll, I was just kind of looking through the chat, and anyone who has a report in progress that they'd like feedback on, just send it to us. And we're happy to provide any kind of feedback and answer any questions that you have. Again, when in doubt, send it to us.
We're getting ready to wrap this particular poll up. While people are finishing up with that, what I've put on the screen are the questions for the next poll. And this poll is asking more about the annual survey that we send out each year, asking you if you've used the Washington Group tools. If you have, where have you used them? What your future plans are, and we also get contact information on the representatives from that annual survey. So, given the particularly low response this year, we really wanted to ask about barriers that you might be experiencing in completing that annual survey. So, Natalie is helping here. I should have mentioned that Natalie is helping with these polls. I think we can close this one and then launch the poll about the annual survey. There we go. Thank you so much. So the first question is, do you experience any barriers in completing that annual survey? And the second is, if you answered yes, or even don't know, there is a multiple choice set of questions or answers. Is that barrier due to language or translation issues? Is the timeline to complete the annual survey too short? So we typically send this out in August. We ask for it back in September. But if that is too short a period of time, let us know. In some cases, the survey may be going to the wrong person or the wrong department or agency. If that's the case, and we don't know that, then that is a bit of a problem. And finally, in some cases, it may be that the person receiving the survey does not have the necessary information to complete the survey, and so we don't necessarily hear back. And then there is an open-ended question asking about barriers that maybe are not reflected in question 2, ones that we couldn't anticipate ahead of time. So your thoughts and sharing in this particular area is very helpful, because we're not quite sure you know, what the experience is on your side. Well, we're waiting for responses to this one. Rajan, I see your comment making the suggestion that a webinar on conducting a disability survey could be useful. Thank you for that comment. We take note of that. Another question about posting all of the materials and presentations from this meeting to the website. Yes, it is our intention to do just that. Kormasa asked about the recording for these meetings, and we will post those recordings. It usually takes us about a week or 2 to get all of the materials cleaned up and sent out. Okay, let's move to our final poll, which is more on our moving forward and what kinds of activities, but also topics should the Secretariat engage in. So the first question is, would you be willing to help the Secretary? Oh, shoot, I am on the wrong page. I am so sorry. Forget that. This next poll is more on these annual surveys, anticipating this idea that that translation may be an issue if you're receiving a survey in English, and that is not a language that is particularly useful. This is a problem. So the idea here is, in question 1, would you be willing to help the Washington Group Secretariat in producing a translation of that annual survey? This, you know, if we had the translation in Spanish or in French or in Arabic or another language, that might help. We are guessing. Question 2 asks to provide that translation or language if the answer to question 1 is yes. And then, of course, your contact information so we can reach you if that's helpful. Tamara is offering to do a translation. Thank you, Tam. You do so much for us. Okay, I know we're running out of time, so let's move to the last poll question, which is about areas or topics that you would like the Washington group to expand work on. And then a question about work plan activities that should be considered for the future. And thank you for releasing that poll. So I think we heard quite a bit of support for the topic of exploring further prevalence differences and why there are variations there. But are there other topics that perhaps are of particular interest to the membership? Or in the case of the second question, are there specific activities that you are interested in engaging in or would be particularly helpful? And we'll leave this open while maybe we close out. Or if anyone wants to come in with a discussion item or to make a particular intervention or make a suggestion, please feel free to do so.
Just mention maybe that we will provide the results of the polls when we do the summary. So
yes,
it won't be a secret. You'll see what happens.
Right. Elena?
Yes, I was curious to know the result of the poll about the countries interested in conducting the cognitive test, but maybe you can provide later on. I only want to make one comment about the annual meeting. It was stressed several times by several people that it's very important to have an in-person meeting. And if you remember, in 2018, we had an annual meeting in person in Rome, and that was the result of a joint effort from the National Institute of Statistics and the World Bank and IFAD. So it was let's say, 3 organizations that worked together. I was wondering if any of us can thinking about that to see if as a national institute can provide something, and maybe there are local or national or international organizations that can support the organization also. Considering also the double possibility to have in-person meeting while other people may be connected in remote. Because I really enjoyed the discussion that we had today. It was almost like to be in person because we were able to share comment and to, to be very active. And for the kind of work that we do in the Washington group, it is essential for me to have this in-person conversation that go behind the 3 hours of the meeting. It's, coffee break, lunchtime, all is very important. So this is something. I also was thinking that maybe we can put together annual meeting and maybe the meeting that the regional group are organizing for themselves. So in the same period, in the same week, they can be both. So some get financed, maybe in some way, through the funds or resource that have as a regional group. And then the other people can join the whole meeting. So I don't know if I make myself clear.
Okay.
Yeah? Okay,
Yes,
the other things that I want to say is that me and Margie are really willing to move on with the working group activity for the psychosocial disability, but without any national institute or also international organization available for conducting cognitive tests or field tests or other activity, we cannot work. So it's up to us as a group to move on. So that is very important. Please keep in mind that we can also organize a webinar to present what is needed to be involved in this process of testing the question. So you all participants can have a practical idea of what is needed. And because maybe speaking like this in general, it seems to be a very complicated task, but it's not. And the training would be useful for any national institute that would like to get familiar with a method that can be used also testing other questions that are not related with the psychosocial disability. So in some ways, it's also capacity building. So please keep in mind these two things, be involved in our group. Let's try together to think how we can have an in-person annual meeting. It would be very nice. It would be very important. Thank you.
I will note that we have put both your and Margie's email addresses into the chat several times today. So if people want to get in touch with both either Margie or Elena or both, scroll through the chat, you'll find their names and email addresses.
Thanks a lot.
And if you can't find it, just send, you have ours, you know, the secretary email, and we'll send it to you.
Right.
Yeah, maybe it would be a good idea, Elena, to have a webinar to just explain how to do the cognitive testing, and so people know what they're getting into, and all the support you already provided. Very briefly, it would be great to have a in-person, our 25th, it would be absolutely wonderful. All we need is a country or with, you know, one organization or a group of organizations like happened in Rome to come forward and provide meeting space and whatever else they can provide. You know, if they can provide a connection so that we can also have virtual, that would be great. And some other kinds of kind of logistic information. But we no longer have any external funding, and we just need to keep that in mind. The money we have from GIZ will go away at the end in mid-2025. It's very targeted. So there would be no travel support, there would be no interpretation support. There would, you know, right now we just don't have any funding. So I saw the thing in the chat thanking us for the Arabic translation. We're absolutely thrilled we could provide it. That is because of GIZ provided that. But to the extent that we'd love to do it in the future, but there is no funding from the UN. There's no funding from NCHS other than salaries for this period. So I hope we can do an in-person meeting. I hope one of you comes forward and says you'll help us organize it. And we'll just have to work within the constraints of the funding the lack of funding that we have, unless somebody decides to smile on us. We'll do what we can, but we have not been very successful recently. Don't know if anyone else has some closing comments. I'm
not seeing any hands up.
We will take everything that's said and try to pull it together and send it back to you with next steps for all of the areas that we feel we did get good based on the poll results as well. And we'll ask questions like, does anybody think they could host the next meeting? We are flexible about when that would be. You know, it doesn't have to be October. It could be some other time. So
yes,
let me close. I know we're running a little late. We're sorry about that, but I want to thank all our member countries and other member organizations and representatives for coming. We wouldn't have a meeting without you, and for making the most we can of the virtual format, and particularly for the good conversations that we have had and all of the input. So thank you all very much. I want to thank the work group and regional group chairs for their participation and the help that we had from the planning committee and the steering committee in doing the agenda for this meeting. All the presenters and moderators and rapporteurs and all the breakout participants, thank you for your participation and for your good comments. Of course, back to GIZ, even though the money is going to run out, we do have the funding now, and they have provided not only support to the regional groups, but for this meeting and for the website. We will miss them when they're gone. And then finally, to our wonderful interpreters from Kalama Translations who have been on this journey with us before. And we have worked with other groups, and we have heard that the interpretation has not always been accurate. But we know that it's always accurate when Kalama does it and helping us through all of the intricacies of meetings. We hope we didn't talk too fast. And we truly appreciate everything you have done. You've seen in the chat how appreciative people are of the interpretation. So with that, and one final thank you to everyone and to my lovely colleagues on the Secretariat who have worked extremely hard over the past years, Julie and Natalie, to keep the Washington group going and to plan this meeting and everything goes around it. Thank you very much. I am deeply grateful. Be well, everybody.
Yep.
Hope to see you very, very soon.
Thank you, everyone.
Goodbye.
Thank you.
Have a good evening. Bye, Mara.
Thank you. Bye.